Hi, I'm Craig Yeager, a sports medicine fellowship-trained orthopedic surgeon with the Colorado Springs Orthopedic Group. Today we're going to bring you into the operating room for a look behind the scenes at what we do to help make you guys feel better. Come in and take a look and see what we can do. All right, so we're going to start the graft harvest here. So this is a quad tendon autograft harvest, which means we'll be taking the distal aspect of the quadriceps tendon. So the first thing we do is we palpate the patella, so you can feel the medial side, the lateral side, and the superior pole right here. Also, usually you can feel the quad tendon. There's usually a firm area right through here. So we make a small incision just right at that superior pole, just like so. Once the incision's made, usually we take some of this small area of subcutaneous fat tissue out underneath. Helps visualize the tissue a little bit better. Kristen's gonna put her retractors in there for me. Just really want to make sure we see this tendon very easily before we go and harvest it. Pretty good view of our tendon there. Next we'll take an elevator, just a small instrument to raise some of that tissue up, make it a little bit easier to see. And next I'll take the camera. I like to use the camera here just to better visualize exactly what we're looking at and find our path. As we harvest this tissue, we want to be very careful to avoid the muscular tissue. That's the vastus medialis right there. So kind of marking my spot here as I come back to the knee, I know sort of where to direct my parallel blade, which is the next instrument we'll use. So as we kind of position this like so. So this is a parallel blade, so I can pick which width we want the graft size to be. So in this case, we have a 9mm blade, which will allow us to harvest hopefully a 9mm graft. I can see in here really well exactly where that muscle is. I can slide this blade and kind of make sure I'm guiding this towards that superior pole of the patella, which really allows for a nice, complete central graft harvest. So I've got my path, which you can see pretty clearly here, where I've started that graft harvest, and we're going to continue to bring that towards the patella. Once I feel the bone, I kind of taper this at an angle. And I come to the other side. And over here, you can see that path very clearly. Continue to elevate that until it meets the other side. There, we've got the graft elevated. I like a full thickness graft. I always close this defect, but I'd much rather take a nice, thick, robust graft for the ACL reconstruction, as opposed to some people take a partial thickness. If you have a section, please. Which is fine, a preference. Yeah. Once you enter the joint, it's not uncommon to get some fluid from the arthroscopy portion that we did right before the graft harvest. Slide a little proximal. I like to elevate a good amount of this graft as well. I think this ensures that the instrument that actually does the harvesting makes sure it stays on plane, stays on track, and you get a nice full thickness graft as opposed to a partial thickness. I aim for at least a couple, 2, 3, even 4 centimeters of the graft to be elevated. That looks good. I'll take the stitch now. So this is a looped suture that'll create a whip stitch construct within the tendon itself. second throw is really nice here. As you can see, that kind of wants to turn up, which will be difficult for our graft harvesting device, which comes next. We'll add this second throw a little oblique. We want to make sure the sutures stay on the side. Okay, so next we'll take our Quad Pro tendon harvester. So this is the device that we'll use to transect the actual graft. So I always choose 1 millimeter larger than the parallel blade. So this is a 10 millimeter harvester, which harvests a nice circular graft. We'll pass the needle in through first, which allows us to get those sutures in. Cut our needle off. Pass that off. Next we'll slide this over our graft. It's not uncommon for this to feel a little tight to begin with, and occasionally we need to trim a little bit of tendon, which may not be a bad idea in this case. So we'll take a hemostat, we'll clamp our sutures here. Twisting this in a circle will often help kind of start the cutting process. It'll allow us to slide through. See that it slid through there. We'll continue that. A little bit of pressure, just enough to advance it. Once we get to around 70 millimeters, this has a tendency to cut a little bit short, so you can see right there, it's maybe a little bit at 75. So we've got enough length of our graft. We want our final graft construct to be somewhere between 65 and 70. Now pull these sutures out. Advance our harvester back. And there's our nice graft. And that looks great. As we prep this, we'll remove the muscle and suture it and get it ready for the reconstruction. Thanks for joining us in the operating room. I hope it was educational for you and that you learned something new. Please like or subscribe, join the channel for more videos.